we are actually going to cover other kinds of claims data and just give you the overview of data that we use to study health. The types of data, just to review the types of data that we use in research, administrative data is one type, and that includes private and public claims. Medicare covers the elderly and disabled. We also have some private insurance sources, and these are usually claims from a single insurer. There are a few facilities we have or accounts that we have, access that we have outside of Schaeffer where there are multiple insurers' claims involved. One of the things to keep in mind with private claims is that the representativeness really kind of depends on their markets. So that means, like, for private insurers, if it's private and if it's employer provided insurance, then who are their workers. Then we have survey data. So these are interviews or data collection from a sample of individuals or entities. So the health measures can, of course, vary in both reliability and extent that they're available. And then we have survey data that's linked to claims. So the MCBS, which is the Medicare Current Beneficiaries Survey, follows people for 3 years and provides all of their claims. HRS also has linked claims if people gave permission, and I think about 80% of the people gave permission. And then we have disease-specific claims, so two versions of that. We have some SEER cancer registry claims, which are Medicare claims, and then we also have Medicare claims from the U.S. Renal Data System, or USRDS, which includes ESRD and kidney transplant patients. We have a lot of survey data, and this is, as I said, not an exhaustive list.
We have member information with age, gender, the plan type, enrollment period. That's the basic information. There are also other tables like confinement, diagnosis procedures. They have been changing their product, so the version we currently have splits the claims into multiple files. Originally they have, in the claims they have all the procedure codes or the diagnosis codes, and the tendency now is that they clean those claims and they produce a set of files with only diagnosis and another one with the procedure code. For these claims, we have two different sets, the DoD and the SES. CMS has a lot of data. You will get lost. It's very hard to understand the logic. There is a monthly claims data meeting where we meet the first Monday of each month, and it's a space to discuss problems, look at what other people are doing, and exchange, like, why do the same thing twice, right? If somebody else is doing it, exchange information, and if you are stuck with something, then we bring the questions there.